At the Autism Service, our combined assessment brings together clinicians from our ASD and ADHD pathways to look at both conditions. ASD and ADHD share similar features and often coexist, and this comprehensive assessment is suitable for children where parents are worried about both. The assessment starts with us sending you a pack of questionnaires that we ask you to complete and return prior to your first appointment. The pack contains 2 sets of questionnaires, one for completion by a parent and one for completion by school. We'll also ask you to send in copies of reports from professionals who have seen your child in relation to your concerns. We then meet with you for 4 assessment appointments. These do not need to be completed in a specific order, and typically you can expect to meet 3, sometimes 4 different clinicians across these appointments. In relation to your ASD concerns, a clinical interview will be completed with you via video call, taking up to 3 hours. This is for parents only, and your child does not need to attend, allowing you to speak openly about their difficulties. Your child's presentation will then be directly assessed during an in-person clinic appointment. The focus of this 1-hour session is on your child, and you'll most likely be asked to stay in the waiting room while we assess their communication, interaction, and behaviour using the ADOS-2. In relation to your ADHD concerns, a second clinical interview takes place with you via video call. This interview is slightly shorter than the ASD interview, lasting around 2 hours. Unlike the ASD interview, we require that your child is available to join part of this call, and the clinician will provide guidance on how best to manage this. Your child's activity levels, ability to concentrate, and impulse control will then be directly assessed in person in clinic, using a tool called the QB test. The test is performed on a computer and takes 15 or 20 minutes. Once the 4 assessment appointments are complete, the team of clinicians will meet to discuss their findings and make a diagnostic decision about ASD and ADHD, which will be relayed to you via video call and in writing. Please note that this pathway is not suitable for children under the age of 6, as we are unable to assess ADHD in very young children. We are also unable to prescribe medication should a diagnosis be made.